So last month, one day, I just suddenly felt a shooting pain in my lower abdomen, and then I soon after started vomiting a lot, and it went on so much that I had to rush to the hospital, and there the doctor gave me some painkillers, to which also my body was not reacting. So he suggested that I get an ultrasound done immediately. So the next day we got an ultrasound and CT scan done, to which we found out that I had a 19 mm kidney stone.
Kidney stones. They are just what they sound like. Small stones that form inside the kidneys. They form when salts and minerals that are normally in the urine build up and harden.
Data suggests that almost 1 in 11 people have kidney stones. It is said that the pain from kidney stones is one of the most painful conditions that you can have.
But is there something that you can do to prevent these stones? All this and more on this very special episode. I am Dr. Sameer Gupta.
And I am Dr. Sonia Lal Gupta, and welcome to Doctors on Call. Kidney stones are small chunks of solid material that can form in your kidneys, a pair of organs that filter your blood. A kidney stone can form when substances such as calcium, oxalate, cysteine or uric acid are at high levels in the urine and precipitate to form a stone. In some cases, they can also form when the substances that normally prevent stone formation are low, like citrate and magnesium. So when these substances precipitate, they form crystals that gradually increase in size, forming a kidney stone. These stones come in different shapes and sizes. For example, some may be the size of a small grain of sand, while others may be the size of a golf ball. A stone may stay in the kidney or travel down the urinary tract, the body's waste and excess water drainage system, that gets stuck, causing severe pain in the belly or side of the back. A stone may cause pain if it becomes stuck and blocks the flow of urine. Large stones do not always pass on their own and sometimes require a minimally invasive surgical procedure to remove them. Though pain is the most common symptom of kidney stone, some people can also have blood in the urine and nausea and vomiting.
To learn more about kidney stones, we talked to Dr. Ruchi Samdani, a senior nephrologist at Jaslok Hospital in Mumbai.
The most common risk factors for kidney stones are high levels of calcium, phosphorus, uric acid and oxalate in the urine, low intake of liquids, certain medical conditions like hyperparathyroidism, sarcoidosis, all lead to increased risk for kidney stones. And additionally, now we also have a new subset of patients who have undergone bariatric surgery. They are also at increased risk for kidney stones. The most common complications related to kidney stones is that the stone gets stuck in the passage of urine and it gives rise to intense pain, which is what we actually hear and see most often. Apart from this, this kidney stone may get infected and the infection may spread in the blood and may cause what we call sepsis. Long-standing recurrent in kidney stones and infections can also cause permanent kidney damage. So treatment for kidney stone depends on the size of the stone and the severity of the stone. Stones which are small in size, which is usually less than 5 millimeters in size, they pass off spontaneously without any effort. These stones, you can facilitate the passage of these stones by increasing your intake of liquids and by certain medications like alpha blockers, which also help in the passage of the stone. If you are able to strain your urine and get the stone, save the stone, then you can send it for chemical analysis, which would be very useful. Stones which are bigger in size, usually more than 5 millimeters in size, they require surgical intervention and which is usually very minimally or less invasive nowadays. The most important precaution one needs to take for prevention of kidney stones is to increase your liquid intake. So you need to be able to form a urine output of at least 2 liters in a day, and to form that, if you are in a hot environment where you're sweating a lot, you need to increase your intake of liquids to up to 2 to 3 liters in a day. Conditions which are giving rise to kidney stones, like if you have certain underlying medical conditions, should also be taken care of so that you do not form stones again and again.
Dehydration and not drinking enough water is one of the most common reasons for kidney stones. So please remember to keep yourself hydrated. At least aim for 1.5 to 2 liters of water every day.
But if you have heart or kidney disease, please talk to your doctor before increasing your water intake.
We hope you found this useful. That's all for now. See you next week on Doctors on Call.